This video is produced by Blind Industries and Services of Maryland, BISM, in cooperation with the Maryland State Department of Education's Division of Rehabilitation Services, DOORS. Tools and techniques for managing diabetes non-visually. Hello, and welcome to Tools and Techniques for Managing Diabetes Non-Visually. In this presentation, we'll explore non-visual techniques for managing your diabetes, techniques that will allow you to control your diabetes in a safe, reliable, and efficient way. We'll also explore benefits of adjustment to blindness programs.
Hello, my name is Lynn Bailiff. I am a certified diabetes educator and registered dietitian, and I'm visually impaired. Diabetes requires daily attention and self-care. Vision loss can make these tasks seem impossible. You may rely on others to do these tasks for you or give up your self-care altogether. But these strategies for dealing with your vision loss can negatively affect your diabetes control. Take charge of your diabetes again by using non-visual techniques. Now, you may think that non-visual techniques are only meant for people who have no vision, but that's not true. If your vision fluctuates or is likely to change over time, or if you find yourself straining to use the remaining vision you have, non-visual techniques may be right for you. They will help you to manage your diabetes in a safe, reliable, and effective manner. Now let us explore the non-visual tools and techniques that you can use to control your diabetes.
There are 7 self-care behaviors essential to controlling your diabetes. Healthy eating, being active, taking medication, monitoring, problem solving, reducing risks, and healthy coping. Healthy eating.
Healthy eating is the foundation of diabetes management. What you eat, when you eat, and how much you eat will affect your blood sugar. Preparing your meals at home as much as possible will help you to make healthier food choices. If you're not currently following a specific meal plan, make an appointment with a registered dietitian experienced in diabetes management. They will work with you to develop a meal plan that meets your food preferences and fits into your lifestyle. Be sure that your meal plan is in a format that you can access. Audio recording is a good choice if you don't have experience with Braille or access to a voice-assisted computer. Before you can make a meal, you may need to restock the pantry. If you go to the grocery store on your own, stop by the customer service desk and ask for shopping assistance.
Could you let me have an aide for shopping today?
Sure, I'll get someone for you. I'll be right with you.
The store employee will shop with you and assist you with getting the items you want, as well as reading nutrition information, package size, and so on.
What's the expiration date on that?
May 17th.
May 17th, okay.
Don't be shy about asking questions. You want to return home with the items that you wanted, not what someone else thinks you need. Now that you're ready to cook, there are some non-visual tools you may find helpful in the kitchen. Talking food scale,
6.6 ounces.
Tactile timer, nesting measuring cups, pen friend.
Being active.
When you have diabetes, physical activity will help you lower your blood sugar, maintain a healthy weight, and promote heart health. If there was an activity you enjoyed before you lost your vision, don't give it up. It is important for your health that you remain physically active. Walking and other activities are all possible. You may need to learn some new skills before you begin, such as learning to travel with a long white cane. Swimming, riding a stationary bike, and using exercise equipment are other options. If you're interested in doing a group activity, such as water aerobics or yoga, arrange to meet with the instructor prior to class to learn the movements. Always talk to your doctor before you begin or resume an exercise program. You may need an evaluation of your heart function.
Taking medication.
Diabetes management often involves taking prescription medication to control your blood sugar, cholesterol, and blood pressure. There are several ways to manage your prescriptions when reading print becomes too difficult. If you only take a few medications, you can use tactile labels, such as Braille or even rubber bands, to tell your medications apart. Another option is to use a pill box to organize your medication. Pill boxes come in all different sizes. You can get some that will hold pills for a specific day, or even a large one that can hold enough pills for an entire week. Pharmacy-generated audible labels may also be available in your area, but you can make your own audible labels by using a device like the Pen Friend. Let me show you how it works. I have a label on this prescription bottle that we had made up previously, and our Pen Friend will read it to us.
Ibuprofen, 800 milligram tablet. Take 1 tablet 3 times per day.
If you use insulin or other injectable medication, you can still draw up and administer your dose in a non-visual way. A pen device is a convenient way to do so. If you've never seen a pen before, as you're dialing up your dose, it makes a clicking sound that you can count to see how many units you're using. Each click for this pen is 1 unit of insulin. No matter what pen device you're using, it is important to prime the pen before each use so that you're sure that the pen is working properly. Let me talk to you how to do that. So what you're going to do is put the pen tip on the pen and remove the cap so the needle's exposed, as if you're ready to give yourself your dose. Point the needle straight up in the air and dial a small dose, usually 2 units. Then expel the insulin. What's going to happen is there's going to be a small drop that's going to appear at the tip of the needle. Now, because we need to do this non-visually, you can tap the tip of the pen against your finger, and the drop should fall on your finger. If you don't feel it right away, go ahead and blow on your finger. Sometimes that will help you to feel the difference in temperature. Sometimes you can also smell the medication. If you're not sure if medication came out the first time, do it again until you're sure that medication is coming out of your pen. Pen devices are typically more expensive than a traditional vial and syringe. So if you choose to use a vial and syringe, you'll need to obtain a device to help you draw up the dose independently. The Canadose is a wonderful device. It allows you to hear the clicks as you dial up the dose, 1 click for each unit. The way it works is the base unit holds your syringe in place. You simply insert your syringe and then take off the cap to expose your needle. And your insulin vials are held by the top section. You simply remove the lid from your needle and then slide the insulin vials on top, which helps to guide the needle tip into your vial. So there's no more bent needles while you're trying to prepare your insulin. You simply turn the wheel, 1 click will be 1 unit of insulin. And this is what it sounds like. And you can just count the clicks to find your correct dose.
Monitoring.
The primary goal of diabetes management is to keep your blood sugar in your target range most of the time. Talk to your diabetes team to set a target range that is right for you. Using a conventional blood glucose meter can be difficult or impossible if you're blind or have low vision. Relying on others to check your blood sugar for you is not your best option because you won't be able to get the information you want when you need it. A talking blood glucose meter will allow you to get the information you need when you want it. Although there are many talking blood glucose meters on the market, currently only the Prodigy Voice meter is fully non-visually accessible, which means all of the meter's functions can be used non-visually. You can set up your meter, run your blood sugar test, and review your results all non-visually. A repeat button is a very convenient function. It allows you to hear the last thing spoken by your meter. So the next time you miss your blood sugar results, you don't have to check it over again. If you're encouraged to get another brand of blood glucose meter that talks, do your research first and find out what meter functions can be accessed non-visually. Don't settle for a meter you can't use 100% independently when there is one on the market that's available to you. Let's simplify the trickiest part of checking your blood sugar, getting blood onto the test strip. Insert your test strip to turn the meter on.
Thank you for using Prodigy Voice.
The Prodigy voice will remain on and ready for the test for 3 minutes. Select a finger to poke. Avoid using your index finger and thumb. Then use your fingernail as a reference guide and select a spot either halfway down the nail or closer to the tip of the finger. Once you have selected the area, poke your finger with a lancing device. Milk your finger to get the blood flowing, but avoid squeezing the finger with constant pressure because this may stop the flow of blood. With your meter on a table or other flat surface, use your opposite hand to turn the meter on its side so that the tip of the strip faces the finger you poked. Hold the meter steady and move your finger in order for the poked area to touch the tip of the strip. The beep informs you that the strip has enough blood and the meter is testing.
Now testing. Your blood glucose, 60 milligrams per deciliter.
Problem solving.
You may not realize it, but you're solving problems related to your diabetes every day. Effective problem solving is based on your knowledge of diabetes. Expand your knowledge by adding a diabetes educator to your diabetes team. Keep up to date by reading current books and magazines about diabetes, which you can obtain in audio format from the National Library Service for the Blind and Physically Handicapped.
Whisk the ingredients until smooth and creamy. Allow dried herbs to steep in the
Another
vinaigrette.
resource is Diabetes Self-Management Magazine, which is available on NFB Newsline, a free telephone reading service. A wealth of information is available online. Ask your diabetes educator for recommendations on unbiased, reliable websites. If you were a computer user before you lost your vision, but now find it too difficult to read the screen, voice-assisted technology such as JAWS will help you navigate the internet. Keeping track of your blood sugar levels, food intake, physical activity, and diabetes medication use will help you to see patterns in your blood sugars. Share this information with your doctor to illustrate your daily diabetes control. You will need to keep your records in a format that's accessible for both you and your healthcare team. You can use Braille or audio recording to keep your records and then use a handwriting guide to put them down for your healthcare team. Or use a computer with speech output to keep records and email them to your healthcare team or print them out a copy.
Reducing risks.
You can prevent, delay, or slow the progression of diabetes complications. Controlling your blood sugar, blood pressure, and cholesterol are essential. Work with your physician or diabetes educator to formulate a plan. There are talking blood pressure monitors and weight scales that you can use at home to monitor your health. You can prevent most diabetes-related foot problems and amputations through proper foot care and daily self-foot examinations. If you have lost vision, you need to use some non-visual techniques to do your daily foot exam. Each evening, when you remove your shoes, smell the inside of each shoe and each foot. A change in what you would consider normal foot odor can indicate an infection. Next, use the pads of your fingers to feel the top and bottom of each foot, as well as between the toes, to to check for any irregularities. Then turn your hand over and use the back of your hand to check for any warm spots on your feet, which can indicate an infection. If your foot exam turns up anything unusual, call your podiatrist immediately, and don't forget to remind the office staff that you have diabetes. Don't wait, because a foot problem left untreated can progress rapidly and cause serious health complications.
Healthy coping.
Your emotional health is just as important as your physical health. In fact, they are intertwined. The way you feel can affect the way you care for your diabetes. Vision loss can bring up a whole host of emotions: anger, frustration, sadness, and helplessness. Seek support from others with vision loss, especially those with diabetes. Having a good support system is an essential part of coping. You will learn that it is possible to live a full, happy, and productive life. The information on this DVD is an introduction to the tools and techniques for managing your diabetes non-visually. Now it's your turn to take action. Build your diabetes team to include your primary care physician, endocrinologist, diabetes educator, dietitian, ophthalmologist, podiatrist, and dentist. They will work with you to manage your diabetes.
In addition to having a support system and a diabetes team, seeking out a formal adjustment to blindness training program is essential. Blind Industries and Services of Maryland offers nationally recognized adjustment to blindness training programs and services for blind and low vision adults and seniors. Comprehensive non-visual training classes offered at Blind Industries and Services of Maryland include cane travel, independent living, Braille, and adapted computer technology. Please call Blind Industries and Services of Maryland at 888-322-4567 to learn more about non-visual techniques and quality training programs for blind and low vision people of all ages. The information on this DVD is not a substitute for medical advice from your personal physician.
AADE7 Self-Care Behaviors trademark reproduced with permission of the American Association of Diabetes Educators. All rights reserved. No further reproduction or distribution without written permission of the publisher. Special thanks to the following: BISM Senior Services staff and students, American Association of Diabetes Educators, Chicago, Illinois, www.diabeteseducator.org. Mars Supermarket, Arbutus, Maryland, www.marsfood.com. Diagnostic Devices Incorporated, DDI, makers of the Prodigy Voice Meter and Countadose, www.prodigymeter.com. Rolling Stock Pictures, LLC, Arlington, Virginia, www.rollingstockpictures.com. Copyright 2010, Blind Industries and Services of Maryland. All rights reserved. www.bism.org.